So today we're joined by Dan Mesko. Dr. Mesko is part of Michigan Orthopedic Clinic in Lansing, Michigan. He did his residency at the Cleveland Clinic and he did a total joint fellowship at Rush in Chicago. So welcome, Dr. Mesko.
Thank you. Thanks for having me.
Yeah. So it seems recently I've had a lot of conversations about medical missions, and I thought that this would be a great topic to talk with a few people about publicly to get their perspective and their experiences. And talking with a little bit with you offline, can you describe how mission work has had an impact on you choosing your career in medicine, and even specifically choosing to go into orthopedics?
Sure. So I have a lot of exposure to orthopedics just through my father, who's an orthopedic surgeon. So I kind of grew up around that, seeing the lifestyle of what that entails. And actually, he was kind of who started to get involved in some mission work, Haiti, Vietnam. He went to, and then ultimately, as I was getting older in college, found a place in Kenya called Tenwick Hospital. That we went out to. That turned into 3 separate trips over 3 consecutive years. And really the first trip was kind of just going out to see what the offerings were, what the facilities looked like, what their capabilities were or weren't in order to do that. And then subsequently over the next few years, we went out and we're performing arthroplasty and some trauma work. And I was in an assisting capacity and just kind of observing. But the coordination of doing that, and I'll kind of never forget the first case I ever did and was a part of out there was the doctor, Dr. Chupp, is a general surgeon who was kind of running the surgical side of the hospital out there, would just coordinate with my dad, sending x-rays of hips, knees, trauma, those sort of cases. And he was really the only option of patients in that community out there. It was him or nothing. And so he would kind of run by ideas and have some of these cases ready to go. And we came out to assist. And the first case that I scrubbed out there with Dr. Chupp was doing a anterior cervical neck fusion. That he's a general surgeon. This person had an injury and just needed stabilization. And he was the only option to do that. And it was kind of a eye-opening experience that in the States, you kind of take a lot of things for granted, the ease of access of a lot of skilled surgeons and skilled specialists. And then you suddenly are in an environment that there's one person and if it's not for that person, you really don't have another alternative. So that was a moving experience for me to be able to initially see that. And then, again, be able to provide orthopedic care in the form of total joints and fracture care.
Yeah. Well, exactly what you said is kind of, it takes you back years in the US. I'm old enough to remember, as I mentioned before, my dad was an orthopedic surgeon. He's been retired for many years, but he had a general surgeon friend who I was talking with, about 10 years ago. He's like, oh yeah, I remember in the 70s, I would pin hips.
Yep.
and it is crazy to me even to think that at not very long ago, it was maybe not exactly like that, but there were general surgeons doing orthopedics.
Yep. You're exactly right. And it was, you researched and figured out how to do the case and you did it.
Yeah. And it's amazing that he was doing a cervical fusion case as well.
Yes, it was.
Something that most general orthopods want no part of that in the US.
Yes, you're exactly right.
So how do you feel that those experiences when you were in college and just understanding the whole process, how do you think that that's made a difference for you in how you practice medicine and treat your patients currently? Sure.
Well, I think for me, it showed the utility of kind of how you can use your skill set. There's just a lot of need, and you don't even have to leave the country in order to kind of find patients that are in desperate need of solutions to their issues. And being able to tackle a lot of those challenging problems, both locally and abroad, it was appealing to me to kind of see how that can be done. The growing up and watching the drive of an orthopedic surgeon, or really any doctor that's just working long and late hours, you don't really get it, I guess, until you go through the same process and the same and you're immersed into it, and then it really doesn't feel like work anymore at that point. I mean, you just see there's this endless need of issues, pathology that comes in to be addressed, and it's enjoyable to kind of be able to take care of those problems and really help and serve people.
Yeah. And kind of to go along with that, the thought that popped into my head is patient expectations. Obviously, in the United States, when any patient goes to have elective surgery, or probably for that matter, any type of surgery, they're expecting to come out like they were, good as new. Just go get my hip or knee replaced. I'll be good as new. Obviously, we know that it's not necessarily that simple, but how are patient expectations? Can you remember back what those were like for the patients in Kenya?
Yeah, no question. I mean, it was the couple of things I will never forget was the post-op pain control was pretty much Tylenol. I mean, it was just fascinating to see the family support of everybody coming in with their family member, having surgery, doing post-op rounds on these family members. And it was just absolutely nothing but just complete gratefulness for trying, for really, even attempting to help them with their solutions and problems. It's not to say you don't see that in the United States either on occasion, but
right.
It was just kind of a different level almost of just the absolute gratefulness for coming out, taking the time to do this, and just attempting to help this debilitating problem. Again, we would run clinic out there, and people would walk in with external fixtures that had been on for a year and a half because nobody was around to take them off, and they had to continue with their life and keep working because that's how they put food on the table. I mean, they don't just you can't just sit at home because of pain and debility in those situations. And I just won't forget to see, what people just proceeded with their lives with, despite how severe of a problem they had.
Yeah, it truly is amazing. I mean, how resilient it seems that people are that are in these, but yet from the story after story that I get, how happy and excited and honored to some extent that people are coming over to take time to take care of them.
Mm-hmm. Yep, absolutely.
Yeah. So you are a total joint surgeon. You've had experience doing some joints with your dad years ago during his medical missions. As a joint surgeon doing this on missions, what are your concerns just from the patient care standpoint?
Yeah, so the concerns are what happens after. I mean, joint replacement patients typically do extremely well. But we have a very coordinated approach, that we're constantly in contact with everyone who's having, touches with our patient, physical therapists, nurses, whoever that may be. And if there's a problem that arises, we know right away and can address it. And, you don't want to find yourself in a setting that it's either a suboptimal operating environment, i.e. it's not safe, sterile enough in order to safely perform surgeries. And, the ability, if you see this patient with bad arthritis or whatever that condition is, if that person ends up with an infected total joint, that's infinitely worse than the situation they started with. And there needs to be an infrastructure set up that there's a physician that's present after the fact. There's some kind of follow-up establishment that's in play. Otherwise, you're really not doing a service per se. If anything bad happens, that can be a life-threatening situation.
Right. And as the saying goes, there's nothing surgery can't make worse, right?
Exactly. Yep, exactly right. Yeah.
Right.
So even the best intentions could turn out poorly if there's not a well thought out plan. And a lot of the stories, I never made it to Haiti with my dad on some of his trips. They were not doing joints on those trips, and they had open windows into their OR, bugs flying in and out, and and they're doing some open trauma work, but that's just not the environment you want to start introducing, like arthroplasty or something that you're gonna have some issues if you start doing that.
Yeah, correct. So as we talked before, you were young in your career. COVID kind of came in, which has really limited the ability for a lot of people to do missions work. What's your hope for the future with this?
Yeah, so I have certainly keeping my eyes open for any opportunities that I can have in order to introduce that. I think I really enjoyed being able to do that. My wife's also an orthopedic surgeon, so we would have the ability to bring two surgeons to help in any capacity from doing that. And I would really like to introduce that. I'm also involved in a residency program too, and I think that's a valuable part of if there's any residents who want to experience kind of what that side of orthopedics looks like. It's definitely a desire that I continue to have and look for.
Yeah. Well, Dr. Mesko, I truly appreciate your time and just getting your perspective. I think it's, neat how you went on missions trip even before you were thinking of getting into medicine, and that sparked it. I think that's really cool. Second generation orthopod as well. And your wife's an orthopod. I know we talked before, your brother's an orthopod, the orthopedic family. If anybody is interested in connecting with you, possible mission opportunities, et cetera, what is the best way to get a hold of you?
Probably my email is going to be probably the quickest way to do that. It's dmesko@michiganortho.com is probably the best way to do that.
All right. Thank you very much, Dr. Mesko, and have a great rest of your day.
Thanks. I appreciate it.